the care team that surrounded me during my pre-cancer and cancer trial. I'm still in communication with, they're really my three superheroes. My dentist who found my lesions, my oral surgeon who cared for me for almost 7 months pre-cancer during that dysplasia phase, and then my surgeon who brilliantly removed the tumor from my tongue and reconstructed it. It's just been phenomenal. I left without any nutrition support or mental health care. So those, I would say, if I would have a lament about anything with my postoperative care, it would be those two things. But the head game is really hard to accept that you've had cancer, that you've also had to include your family in this horrendous journey. In sharing that, I don't mean to imply that for sure it's not my surgeon's job to do that, maybe not even his nurses. That was really hard for me.
There's a lot of different surgeons and speech therapists and radiation oncologists and oncologists that are all working together on cases like mine, and the tumor board that meets, and they all discuss the case and plan the best way forward. Supportive oncology team, which really is the pain management team and is trying to keep you sane and comfortable during treatment. So that was another support system there. I would say something that was disappointing a little bit was you have to be such an advocate for yourself. I think these hospitals and institutions have so many patients, unfortunately. I had to really reach out myself to make things happen. There was speech therapy. There's only one lymphedema therapist. So I was on a wait list for 6 months and I had to really chase it down. I had my parents help me able to call when I couldn't talk.
We had the radiology nurses who were extremely helpful during that time period when I had all the sores and I was having my radiation, and they were very, very helpful in day-to-day maintenance of that.
No, I did not work with a dietitian. I think given my weight loss, perhaps I should have, but I just tried to eat foods that were calorie dense, and I tried to stay hydrated and tried to eat lots of calories. I did not see a speech pathologist, and I guess my later experience with head and neck cancer has led me to believe that every head and neck patient should see a speech pathologist as soon as you're diagnosed. I think they're a crucial part of the team.
When you're dealing with radiation, you are meeting with a dietitian pretty much every week, and they help you, well, when I could eat, I should say, they help you deal with all the side effects of it and the different foods that you need to eat to keep your energy up, especially when you're off that feeding tube. Your nutrition goes way down. You're not getting the calories, you're not getting the nutrients that you need. So they have to help you figure out a way to do that. And so there was a wonderful dietitian that worked with my radiation oncology team.
And so when I met my speech therapist, it was after all of my treatments. If I would have known her, she would have probably given me exercises during treatment that would have helped with my jaw and the muscles and all that kind of stuff. And so when I went to her, she started to give me exercises that I could do while I'm driving. It's like yawning and doing things with your tongue just to strengthen those muscles in your mouth. But her challenge to me was to take a bottle cap from a water bottle, just like this one, and fill that bottle cap with water and drink one of those an hour. And so that was a challenge, and I would see her about every week, and she pushed me hard to try to do those things.
And what I know now is that there are people that are referred to as navigators, cancer navigators, who will assist. I retained her because I couldn't go to a meeting with a doctor and first remember anything that we talked about, because again, it's like I still can't believe I'm here. And she was wonderful. She took notes and she asked questions. She would pick me up and I'd have to get in a wheelchair to be driven to an appointment. So I refer to her as my angel.
I just recently moved to the survivorship program, and it's a whole new team of doctors that deal with people that are the 3 years outside of remission or 3 years into remission. I deal with audiologists, speech pathologists. I'm actually going in tomorrow to meet with a surgeon who might put stents in my station tubes to dry open up so I won't have issues with flying. Eye doctors, it's an entire team. There's so many specialists that help out with either, looking at making sure it's not going to reoccur and also helping with dealing with the side effects. I would say I'm probably going in once every 2 months. They're really good at scheduling to where when you go in, they try to do all the visits in one day so you can go see the whole team and knock it out. But, again, I'm here. So it's just dealing with it, managing the side effects. And the hospital I'm at now, they do a really good job at trying to help you with your side effects, which I think are important